Okay. This is just in case there's a video. I want to do this, right? Okay, anyway. Let's just chat for a bit. How about that? Why not? Why not just chat for a bit? I have some questions that I wrote down. No, they have a boyfriend. Let me just do something real quick. That's funny. Okay, let's learn some stuff. Just know that if you guys have any questions that you want answered, I will do that too. Let me just... Okay, there we go. Okay, let's see. So far, what are the terms of the spectrum of autism right now? Because I'm autistic. I've told you guys this, I'm pretty sure, a few times. What are the terms of the spectrum of autism? Yeah, but the way I see it is high, medium, and low functioning. Is Mayo Clinic... I have to ask if Mayo Clinic is... Is Mayo Clinic... What was the term? Reliable. Top ranked for quality more often than any other. Okay, good to know. Let's see autism spectrum disorder. Overview. Autism spectrum disorder is a condition related to brain development that affects how people see others and socialize with them. This causes problems in communication and getting along with others socially. Relatable. The condition also includes limited and repeated patterns of behavior. Yeah, you can see that. The term spectrum in autism spectrum disorder refers to the wide range of symptoms and the severity of these symptoms. Autism spectrum disorder, or ASD, I'll just call it ASD, includes conditions that were once thought to be separate: autism, Asperger's syndrome, childhood disintegrative disorder, and a form of widespread developmental disorder that isn't specified. Yeah, Asperger's isn't a thing. Hey! Don't boo me, Tabs. I'm doing some research. Should I do music while I'm doing this? Nah. You know what? No. I was going to, but no. Right? Do I have a music thing on here, anyways? Oh, I do. Okay. Autism spectrum disorder begins in early childhood. Over time, it can cause difficulty functioning in society. Yeah, I get that. For example, people with autism spectrum disorder may have problems being social. Yep. Or when in school or at work. School is definitely hard for me. Often children show symptoms of autism within the first year of life? Holy shit, that's interesting. A small number of children with the condition appear to develop as expected in the first year, then between 18 and 24 months of age they may lose some skills and develop autism symptoms. There's no cure. Of course there's no cures. Whatever. Not Asperger's, but now that you say Asperger's syndrome, that's what I thought people were saying. I thought people were saying Asperger's and not Asperger's. but getting treatment early during the preschool year can make a big difference in the lives of many children with the condition. Symptoms: some children show signs of autism spectrum disorder in early infancy. That's pretty early on, but okay. Such as less eye contact. That also sounds like ADHD in a way. Not responding to the names or not being interested in caregivers. Other children may not develop as expected for the first few months or years of life. Then they suddenly become withdrawn or aggressive or lose the language skills they had before. Signs usually are seen by ages 2 to 3 years old. Some people in the mild range of the autism spectrum may have more symptoms that aren't noticed early on. They may not be diagnosed until middle to late childhood, when there's a greater need to communicate and be social. Sometimes a diagnosis is made for the first time in adulthood, though symptoms were likely present during. Yep, that makes sense. My dad wasn't diagnosed with autism, but if he went somewhere and explained da 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 da, they'd definitely diagnose him with autism and ADHD, in fact. So I'm like my dad. Like the way I see it, I see me and him and me. You know what I mean? Each child with autism spectrum disorder is likely to have a unique pattern of behavior that depends on whether symptoms are mild, moderate, or severe. I have to look that up now. What is severe autism? Severe autism, known as there's levels of autism, is the most debilitating form of autism. It is characterized by significant challenges in social communication, interaction, and restricted repetitive behaviors. Okay, so there are levels. There's 3 levels of autism. Got it. Okay, that's what I was looking for before. Let me write that down. What did I look at? Oh, okay, there it is. Okay. What was it? What was it said? It said mild, moderate, or severe. Mild, moderate, severe. I want to write that down so I can know that. That's interesting because I know it used to be low functioning and high functioning. There was no middle ground. But I'm the middle ground. I'm an example of the middle ground, at least in my eyes, you know. Many individuals with severe need constant supervision and care to ensure their safety and well-being. So the ones that would... You know what, I won't even say that, but the ones that can't function on their own, basically. Support needs. Okay, let's see. Behavioral challenges. Yeah, I get that. Assistive technology for when they're talking, right? Yeah. Okay, I see. I get it. Damn it, tabs. Each child with autism... Okay, I read that already. Some children with autism spectrum disorder have trouble learning, and some have signs of lower than usual intelligence. If people want to read this at all, just on their own time, there's the link. Let me put this in a folder real quick. Where is my research folder? Because I know, actually, you know what? I'll just make a new one, right? If I can spell right. Just chatting research. There we go. Because each child can have a unique mix of symptoms, sometimes it can be hard to tell how severe the condition is. It's generally based on how severe the symptoms are and how much those symptoms affect the child being able to function. Got it. Below are common signs: social communication and interaction. Okay. Well, don't respond to the name, aggressive or passive, or disruptive. Okay. Okay, interesting. Rax, you can't eat the functioning. Babies develop when to see a doctor. Babies develop at their own pace, and many don't follow exact timelines found in some parenting books. But children with autism spectrum disorder usually show some signs of delayed development before they're 3. Symptoms often appear early in development when there are obvious delays in language. Okay, that's interesting. Okay. Okay, interesting. If I can spell severe right, goddamn. What information? Let's see. What information is needed for an autism diagnosis? Let's see. An autism diagnosis relies on a comprehensive evaluation process that combines observations of the individual's behavior with information from parents, caregivers, and potentially other professionals. This process involves assessing social communication skills, repetitive behaviors, and other characteristics consistent with autism. Okay. Let's see what they use. Schedule. They use a schedule or a checklist to assess social communication, play, and repetitive behaviors. Okay. Medical exam. Physician may conduct a medical exam to rule out other potential medical. Yep, that makes sense. Dang it, Rex! Stop eating my shit. Well, not you know what I mean. Okay. Assessments of. I wonder if there's a video we could watch. Okay, I found a good video, I think. I found a good video. Hold on. Well, let's turn it down a little. Just a little bit. Okay, right here. Tell me if it's too loud, by the way. Hold on, it's not working. Hold on. I forgot something. Properties. Opera. Add executable. Okay.
What is autism spectrum disorder and what does it look like? By Kristen Coffey, Dennis Doherty, and Laura.
Hold on, I want to add this to a playlist. Let's see. Is this my live channel? Yeah, that's my live channel. I want to go to this channel. Hey, that's exact. Oh, I found the one that I wanted before too. How to spot? No. Oh, pediatrics. Okay, sorry.
What is autism spectrum disorder and what does it look like? By
Is
Kristen
this
Coffey,
good volume
Dennis
for you
Doherty,
guys?
and Laura Weissman.
Quick concepts or short videos that describe a key physiological or theoretical concept or demonstrate a brief procedure.
Autism spectrum disorder is a neurodevelopmental disorder which is characterized by persistent deficits in social functioning, communication, and language, and by the presence of atypical repetitive behaviors, sensory sensitivities, and or
I do have repetitive behaviors. I mean, I poke a lot of people. I punch my stepfather in the arm a lot. Sensory sensitivities, of very much have a sensitivity, especially with my hearing. Like, if there's a big firework or something, like somebody lights off a firework or something, and it's very loud, I will be like it'll, especially at night, it'll be very hard to go back to sleep and feel comfortable in my own skin. Restricted interest, I
or
wouldn't say
restricted
that, but
interests.
I don't know.
The most recent data from 2018 reveals that 1 in 59 children in the U.S. are
1 in 59 children. I don't know. 1 in 59? I guess that is a lot of children in the US with autism. Some are high functioning, some are low functioning. Mild and severe, you know, that kind of thing. Mild, moderate, severe.
diagnosed with autism spectrum disorder, and it is 4 times more common in boys than girls.
I don't doubt that. I don't doubt that. I do not doubt 4 times more common in boys than in girls.
The term autism spectrum
Thinking of that, I've never met an autistic girl. No, I have. I think I have. Never mind. I think I may have. I don't remember though.
disorder encompasses the previously used terms autism, pervasive developmental disorder not otherwise specified,
Pervasive. PDDOS? Hold on. PDDOS? Hold on. I'm gonna write that down. What is PDDOS? Actually, you know what? I need to write down what that means as well. Pervasive. Hold on. Developmental disorder. Not otherwise specified. Okay, I'll look that up too.
and Asperger's syndrome.
I know what
It is
Asperger is.
important
I
to
don't use it.
understand that when you
From what I know, is that Asperger is the higher functioning side of things.
are working with a patient with any of these diagnoses, the following information will be applicable. For the purpose of this module, we will use autism to include all.
Okay,
Although
that's
all
good to
patients
know.
with autism have some level of social, communication, and behavioral symptoms, symptoms may appear differently in each individual. Our mantra is if you've met one person with autism, you have met one person with autism.
Yep,
What does autism spectrum disorder look like?
he's autistic, isn't he? Is this a real autistic person or is he just acting? Because I can't tell.
Often, these patients appear physically indistinguishable from their peers. However, subtle behavioral and communication symptoms may become more apparent upon interaction with a patient with autism. They might
Yep.
have a hard time making
He is autistic, got it. I hope. I hope he's autistic, but I also don't hope. I hope he's not acting, you know?
eye contact and avoid interactions, or they might be overly friendly and not understand personal space. The patient might have spoken language, or they might be nonverbal. If they do have spoken language, they might have difficulty with back and forth conversation, or might struggle with small talk, jokes, or sarcasm.
That's me. Oh, that's nice, Tabs. Oh, that's cool, Rax. See, I don't know that often. You know? I didn't know that. But, what was it? What was I gonna say?
Conversation, or might struggle with small talk, they might
Yeah, me and sarcasm. Sarcasm. See, this is sarcasm. You know?
have difficulty with back and
At times, if you sound serious, I'm gonna think you're serious.
forth conversation, or might struggle with small talk, jokes, or sarcasm.
Small talk is hard
Patients
too.
may have difficulty with sensory experiences, such as certain sounds, textures, smells, or touch.
Definitely smell. Definitely sound and smell for me. Because if I smell something I don't like, I stay away from it. And if it's food, then I don't eat it either.
Some patients may have self-stimulating behaviors, such as hand flapping and rocking, pacing or jumping, or repetitive vocal sounds or phrases.
I have the vocal one with the phrases or sounds. I wonder if this is ADHD, because I bounce my legs a lot. I wonder if that's ADHD or autism. And what's the other one that I have? If I get very excited, I go, you know, like very excited. I have to get very excited for something.
It is important to note that these
Or about
behaviors
something.
may be exacerbated during times of stress. In settings like a hospital or clinic, a child may not be able to use these behaviors. This can become overwhelming. Many patients with autism do well with routines and predictability. This can result in greater success in the home and school settings.
Disclaimer: use of this video is subject to the open pediatrics legal terms of use. Provide general information and education about the care of critically ill child. Okay. Well, that was interesting. That was interesting and definitely a good one. I like the video. There's 0 comments. Well, I subscribe to the channel anyways. Okay. AUDHD, because I also have ADHD, so the overlap of autism and ADHD explained.
So how common is it to have both ADHD?
Wait, this was one of my questions. Wait, hold on. I have one right here. How common is ADHD paired with autism in a diagnosis?
And autism? And when individuals do have these two issues, what does it look like when they overlap?
It looks like shit, let me tell you that.
I'm Dr. James Thatcher. I'm a licensed clinical psychologist, and today I'm going to go over the prevalence of having both ADHD and autism, other known as ADHD, along with several different areas of how these two interplay with one another.
Sorry, Touch Portal stopped working for a second.
So living with both autism and ADHD, other known as ADHD, can have a lot of overlap between one another. For instance, difficulties focusing, social interactions. However, they also bring their own unique struggles. For individuals with both autism and ADHD,
Yeah,
having these two issues can sometimes feel overwhelming.
it is
But
overwhelming.
understanding how they overlap.
When we're boyfriends, Tabs. When we're partners, no, I'm just kidding, Tabs. I'm not gonna touch your portal. What's wrong with you?
How they interplay with one another, and how
Hold on, I
they're
gotta go back a little.
understanding how they overlap, how they interplay with one another, and how they're different can give us some key insights
I know they're
and
different.
how to cope with them. So autism and ADHD, or attention deficit hyperactivity disorder, has gotten a lot of notoriety here lately, and the more and more research that comes out, people are noticing that these
I know that ADHD has 3 kinds: inattentive, hyperactivity, and combined type, you know? There's combined, which is both inattentive and hyperactive, which I'm pretty sure I have. Inattentive, pretty self-explanatory, you have bad attention. And then hyperactivity, you're just always hyper.
these two issues are very much comorbid with
Okay, maybe not always hyper, but hyper.
one another, meaning that they occur at the same time. Let me walk you through what both the DSM-TR and current research says about these two co-occurring issues. So research that's been coming out in the past few years has consistently found that autism and ADHD co-occur with one another. So in a large meta-analysis,
Wait, hold on, sorry, I wasn't...
consistently found that autism and
Consistently?
ADHD co-occur with one another. So in a large meta-analysis meaning to where they take lots of different clinical studies and combine them, and they look at the
You know what I like about that? He's explaining what a meta-analysis is, so you don't have to click off and look up what meta-analysis means.
stats in each and every single one of them, and they run their own stats on the overarching findings of all of those things.
Okay.
The Journal of American Academy Child and Adolescent Psychiatry back in 2019,
Now I have to see if they have links in the description, because this isn't... If this isn't properly sourced, I swear to God. Visit Okay. Wait. Oh my god, it's actually. Ooh. Okay, maybe we should read some of these. They're actually properly sourced. I would never know how to source it like this, but that's pretty cool. Okay, sorry about that.
They found that 28% of children that had autism.
Wait, 1/8?
28%
28.
of
Okay.
children that had autism also had ADHD. However, when looking at clinical samples instead of community samples, they found that this percentage drastically jumped up to 50 to 70%.
50 to
Looking in
70%?
the other direction, looking at folks with ADHD, the Journal of European Child and Adolescent Psych.
Am I too loud? No, I should be. Is the video too loud for anyone? Perchance?
Psychiatry back in 2019 suggested that 15 to 25% of those
I just realized something. Do you guys need the captions on?
individuals also had autism,
No, I won't do subtitles on this people.
especially when the study focused on social communication difficulties. A comprehensive review of neuropsychiatric disease.
Is it actually tabs? Okay, Rex, can you tell me if it's actually on the quiet side? Because it's in the yellow. It's literally in the yellow. And it's as high as I can do it without blasting people's ears. As far as I know. Are you fucking with me, tabs? Could you guys understand it though? Because I can turn it up a little bit. Actually, hold on. I can turn it up like this. Actually, can't I?
In treatment back in
Nope, that didn't work. Let's just turn it up like this.
2020 found that the pooled prevalence of having both ADHD and autism in children
Is that better? Because I can't turn it up much louder. For whatever reason.
was 40 to 50%.
Hold on, I
It
gotta
was
read
found
that.
that the
read that
pooled
again.
prevalence of having both ADHD and autism in children was 40 to 50%.
40 to 50? So about half.
making it the most co-occurring disorder
I thought so.
between those two issues. So before I go on and give you one more study, you may be asking yourself, wow, these numbers jump quite a bit. 40
Yes, I
to
do.
50. Or even before I was talking about 50 to 70%. So again, we're not just focusing on one single study. I'm trying to give
I forgot. I already forgot that he wasn't focusing on one single study. Because all the numbers were jumping and I was like, oh wow, those are some big numbers.
you and these different journals were discussing a range of different studies, and they use different methods to find these out. But any way that you cut it, it's significant. In another research paper published back in 2022 in Nature of Neurology, they found
What is that, 3 years ago? That's pretty... Oh, wait, I gotta keep listening. Hold on.
that genetic factors may explain most of this co-occurrence. It's where they found
Okay. Genetics. That's basically what it comes down to for how big it is. Okay, I get it now. So probably my dad does have it. I don't know. I mean, his father said he has it, you have it, I have it. You know?
it happened 30 to 80%. See that huge jump there? Again,
Wow.
they're looking at
Hold on, 30 to 80? That is a big jump. Holy shit. No, don't eat my jeans. No. You know, diarrhea is hereditary. It runs in your genes.
different studies. And again, regardless, no matter how you cut it, this is pretty significant. Let's go over some ways that these two
Did
issues
I not like this video yet? No, guys, stop eating jeans.
interplay with one another and create some very unique difficulties for folks with ADHD. So number one that I'm going to go over is sensory sensitivities and impulsivity. So sensory sensitivities can be a part of both autism and ADHD. And impulsivity.
Wait, so you're saying... Wait, hold on, what was it he said? Sensitivities, okay. So they can appear in both ADHD and autism, I get that. But does that double the problem?
Be a part of both autism and ADHD.
No, not my pants.
Impulsivity, that is...
Joke's on you, I'm not wearing any pants. Well, I am wearing pants, I'm wearing shorts, but you know. Hold on, let me snooze that.
It's going to be more with the ADHD. So sensory sensitivities, that's looking at folks getting overwhelmed with lights, with smells, with loud noises. So when they're out in public, say at a crowded mall or in a restaurant where there's lots...
Here's the thing, I have audio sensitivity for loud noises, like loud sudden noises. But let's say I'm in a crowd of people and I'm interested in what's going on or whatever, I tune out all the noise that I hear. So I could go to a mall, like a full mall or something, and just, like, the noise will be like my, whatchamacallit, will be like a noise machine that you have at night while you're sleeping.
Lots of people talking, there's lots of smells going on, there's different fluorescent lights that are going on. It can be overwhelming. And then when you couple this with impulsivity, so not thinking through, reacting instead of thinking, sometimes you
I've done that a lot, so I can relate to a lot of this, actually.
can run into folks that have a meltdown or just want to leave or need to leave. And I should also say that having...
I wonder if higher functioning, like like not moderate or severe, maybe moderate or mild, you know, can, like, because the only time that I feel like I need to leave is usually when my social battery is drained, which has happened quite a few times.
I think both of these things can make that environment just chaotic and disturbing and even painful. So again, they may just want to leave, and this may lead to them becoming burnt out and overwhelmed and needing to get out of it. Number 2 is difficulty with focus and attention. So folks with ADHD are going to have a hard time policing their attention. They're going to get distracted, disorganized. Folks with autism can have something what's called hyperfocus, to where they're just laser focused on one single thing, and it's hard for them to move on from that. So when you have a combination of these two, you're going to have difficulty with prioritizing what needs to be
That's funny, Rax.
done. You're going to have issues with disorganization. You're going to have issues with not just procrastination, but with putting things off to the point that it's impairing. So what this looks like at work and school is, kids may put off getting their homework done on time or studying on time. At work, it's going to create difficulties meeting deadlines, and it's going to create issues with being consistently productive. So number 3 is social communication struggles. So folks on the autism spectrum are going to have difficulties in being able to pick up on social cues and rules. They're going to have trouble engaging in conversations. They're going to come off as quirky or say things a little awkward now and again.
Come off as quirky? Yeah. Nobody's ever said, you're kind of quirky, aren't you? But, like, I can imagine that I've seen quirky, like, in a way, like, being like, waffles, like, out of nowhere, but I've never done that. But, like, saying just random shit, you know?
And folks with ADHD may not be paying attention to those social cues.
Okay, that makes more sense. That makes sense because I'm autistic and have ADHD. I have ADHD, right? So, ADHD is where I have paid attention to people. I have looked at them, listened to them talking, and the problem is it'll go in one ear and not the other. Like, I'll hear it, it'll stay in my brain for a second and leave. and it's infuriating when, like, not just me but other people, when I'm like, okay, so we're you're saying something, and then I'm like, what? Like 3 different times. That's fair, Rex. That's funny too.
So they may interrupt you, they may talk over you, they may talk at you, and not really get in the moment that they're making a social faux pas or a mistake.
Okay, this is the last news I can use, so I'm sorry.
And then when you have both of these,
If you're here and you're in an ad while I'm watching this or hearing or talking with it, I'm sorry. You can watch this on YouTube unedited,
issues combined to where you're not picking up on the social
after I'm done streaming.
cues, and then on top of that, not understanding them, well, then that can leave individuals feeling very isolated and alone, and that something is wrong with them.
I actually should I keep what's executive functioning? You know what? Because I get the social communication struggle.
Issues. So number 4 is executive functioning and organization. So folks with ADHD can have difficulty being able to plan, being able to
True.
prioritize, being able to think ahead of time. Both autism and ADHD can have executive functioning difficulties. So what is executive functioning? So that's decision making, forward planning, managing our time. So folks with ADHD can have difficulties with all of those things, prioritizing things.
About something I'm not getting their college reading might be. Is that happening? I'm getting what I said, so I don't try. That's funny.
Things off, being impulsive. But folks on the autism spectrum can have cognitive rigidities, needing things to be a certain way for them.
Yeah, I get that. Relatable. Emotional regulation and stress management, managing stigma and misunderstanding, finding effective support. Effective support. Okay, so now we're done with that. Going back to the Just Chatting stream. So now that we're done with that, let's where do I have 2 notifications? Dr. Mike and Dr. ER. Okay. Save to a new playlist. Just Chatting research, just so I can, like, stuff, whatever. Okay, right there. Yeah, is everybody learning stuff as stressed as I am? Okay, let's see, what's this? The comorbidity of ADHD and autism spectrum disorder. We just listened to this guy do that, but I may read it another time in my own time. The co-occurrence of autism and ADHD in children, what do we know? Dang it, there's so much egg. Do you actually have ADD though? Because there's no such thing as ADD, by the way. I said it earlier, ADHD, you weren't paying attention. In biology class? Really? They didn't do that in my school. At least I wasn't paying enough attention. No. Okay, that's good to know. Okay, let's go over here. What information is needed for an ADHD diagnosis? Oh wait, no. What is PDOS. What information is it? Okay. What is PDDoS? Short for, what? Not DDoS. What? No. PDDoS. PDOS or PDOS. That's what I've heard before. Commonly refers to the pre-departure, or that is not what I wanted. It's not what I wanted. PDOS meaning medical. PDDS or whatever. Patient-derived organ. I don't know. I can't find it like this. I actually have to look it up. What is pervasive developmental disorder? Sure, that's PDD or whatever. I don't know. Is a group of childhood developmental disorders now included under the umbrella. Okay, it is characterized by impairments in social interaction, communication skills, and the presence of repetitive behaviors. And PDD encompasses conditions like autism, Asperger's, and okay, not otherwise specified. I don't get milder or less pervasive than those with. Oh, okay, I see. Well, I can't skip this ad because I need that last ad skip. So I'm sorry, guys. What is Asperger's syndrome? Whatever. What information is needed? What information is needed for an ADHD diagnosis? Okay, hold on. Is ADD still a diagnosis? No, ADD, attention deficit disorder, is not a current medical diagnosis. Medical sources say ADD is an outdated term that was used to describe what is now known as ADHD. Only recognizes ADHD, which encompasses both inattentive and hyperactive impulsive symptoms. ADHD is now categorized into 3 subtypes. Predominantly inattentive type. This subtype is often what people referred to as ADD in the past. Predominantly hyperactive impulsive type, and combined type, showing both inattentive and hyperactive impulsive symptoms. So Rex, you have ADHD, but the predominantly inattentive type of ADHD. You can still call yourself ADD though. Exodia, the neurospacing one, and when the God damn it, tabs. 19. Wait, what? It was replaced by ADHD, which included both and whatever. And the name disorder was changed to ADHD. This revision. So it's like, yeah. Okay, now I understand why you're... Okay, I didn't know you knew they changed it. I'm sorry. I'm not angry at you. I was just like... This is an educational stream today, you know? Well, there's no such thing as controlling the hyperactive part. You're not hyperactive. It's attention deficit / hyperactivity disorder. The slash being like and or. You know? It's just called attention deficit hyperactivity disorder. You know what I mean? There's no such thing as controlling the hyper part. You just don't have the hyper part. As far as I'm concerned. What information is needed for an ADHD diagnosis? So you do have ADHD. You do have hyperactivity. So you don't have ADD. You have ADHD. Okay, usually with the hyperactivity of ADHD, you can't control anything. Ah, okay, yeah, I do that too. I've been doing that this whole time. Okay, I get it. Okay, impact is a comprehensive evaluation is needed, including a review of symptoms, history, and impact on daily life. This process typically involves a clinical interview, symptom checklist, and symptoms feedback from family or teachers. Interesting. A thorough interview with a healthcare professional. This includes reviewing personal, medical, and psychiatric history from childhood to the present. The clinician will assess if the symptoms met the diagnostic criteria for ADHD. Symptom checklist. Standardized questionnaires. These scales may be completed by the individual or parents, teachers, whatever. Examples include the child attention profile, behavior assessment, and Connor's writing skills. Let's see what these are. Okay, you know what? I won't bother with these links right now. Okay, next question. How common is ADHD? Well, we already got that answered, which is good. But now we have to figure out what to do. I'm an adult. You can control it much more than when you're a little. Okay, I get that. Just like I've learned to be able to focus more than when I was little, you can control it the older you get. But I will not go down this road with you. I refuse to argue. If this goes on, I will leave. No, I'm not arguing with you, Rex. Okay. Is this one of those times? It's one of those times, isn't it? But yeah, I'm not saying you can't say you have ADD. You can say that. I don't care. I'm not trying to argue. I thought you couldn't control ADHD, but I'm guessing it's because I don't just have ADHD that it's going to be harder to control. You know what I mean? I'm sorry, Rex. I didn't mean to get you upset. Okay, anyways, let's change the subject from that because... Rex, are you still there? I'm sorry. I think it's harder for me to control ADHD even as I get older because, well, I have autism and ADHD. I don't mask very well. So I think I get it, Rex. Are you still there, Rex? I feel bad now. I don't know if she left. Okay, I guess I'll go. How severe can OCD get? Severe OCD. Oh, okay, Rex. I'm sorry for getting you upset. Let's see. How severe? What are the symptoms of OCD? Obsessions, intrusive and unwanted thoughts. Compulsions, behaviors performed in an attempt to relieve stress or anxiety and over which an individual has little or no control to stop. I have one thing like that. I have two things where if I think my computer's not plugged in, I'll push it in some more, or if I don't think things are plugged in, I'll try to plug them in more. And then my refrigerator, I'll push on it like this on the handles, the two handles. I'll go like push, you know, making sure it's closed all the way. Tend to have a theme such as fear of germs, the need for symmetry. Sometimes I do have the need for symmetry, but not all the time. Or intrusive thoughts about, nope, I don't think I have that. I don't think I do. I don't think I have thoughts about harming others or myself. Not wanting to touch things others have touched. I don't have that problem. Anxiety when objects aren't placed in a... Okay, not anxiety, but a need to move them. Always wondering if you lock the door, turn off the lights. I've done that multiple times. Unwanted intrusive images of taboo subject matter. Okay, I think I've had that before. I'm sorry, Rax. I didn't mean to make you upset. repetitive thoughts of doing things you really don't want to do, compulsion symptoms, excessive hand washing even if your skin is already raw. Nope, not for me. Arranging objects in a precise way even when it's not necessary, or I don't think so. Repeatedly checking doors, the stove, or other things to make sure they're off even if it means you can't leave the house. I've done something similar but not like that. Silently counting or repeating a word or phrase even though you want to stop. Nope. You can't get to school or work on time if at all. You're unable to attend or enjoy social activities. Your relationships are troubled. I have to talk about this. What causes genetics? Brain structure and function. There appears to be a link between OCD and differences in the frontal cortex and subcortical structures. Brain people with OCD also have a hyperactive neural circuit between the prefrontal... Hey Pocket, how are you today? Between the prefrontal cortex, which affects decision making, and the nucleus accumbens. Environment. OCD may develop as a result. Oh, that could be why. But more research is needed to fully develop this theory. That's fair. Children sometimes. Okay. Are there other conditions associated? Oh, with OCD, depression is on here as other symptoms. There's conditions associated with severe symptoms of OCD. Can have coexisting. Oh. Interesting. I'm doing good, Pocket. I'm glad that you're doing good. Let's see. What characteristics does OCD have? I already found that out. What information is needed? How does one become diagnosed with OCD? Hold on, let me, I forgot to do something. Just sharing research. There we go. To be diagnosed with OCD, a mental health professional must assess an individual's symptoms and determine if they meet the criteria outlined in the DSM-5. This involves a clinical review and potentially the use of standardized assessment tools that evaluate the presence and severity of obsessions and compulsions. Cause significant distress or impairment in daily life. Okay, I'm not gonna... Why is there a Take the OCD quiz and it's sponsored? What the fuck? No, there's so many things I don't care about. Oh my goodness gracious God. Oh, that's interesting, Rax. Does it impair you day to day? Because I think I have OCD. I think I was diagnosed with OCD. That's kind of like what it is. How often do depression and anxiety show up at the same time? How often do depression and anxiety show up at the same time? Depression and anxiety frequently occur together. Oh, they occur together. Okay. It's estimated that around 60%, that's a big number, of individuals with anxiety will also experience symptoms of depression and vice versa. The high rate of co-occurrence known as comorbidity, such as strong connection between these two. Okay, that's good to know. That is good to know. So I'm going to write that down real quick. Not the whole thing, but 60%. Interesting. Okay, this one I found out about when I looked at it again. What is the difference between ODD and DMDD? Yeah, DMDD. Let's see. The army somewhat... Oh, I'm sorry to hear that. Meg's fucking with me on a daily. I do still have to have things straight. That makes sense, and I'm very organized. There's more to it than that, but I can't think of all the BS. That's fair, Rax. I understand that. Oppositional defiant disorder, or ODD, and disruptive mood dysregulation disorder, or DMDD, are distinct conditions, though they can share some overlapping symptoms. The key difference lies in their core focus. ODD is primarily a behavioral disorder characterized by defiance and hostility, while DMDD is a mood disorder marked by severe recurrent temper outbursts and persistent irritability. ODD, defiant, disobedient, and hostile behavior towards authority figures, symptoms, frequent arguments, refusal to comply with rules, vindictiveness, and blaming others. Yeah, it definitely does. It definitely does, Pocket. Also, if you want to watch the whole of this again from where you, because you didn't come in, I don't think, at the beginning, but I started with Mario Bros. Wonder, and then I was like, you know what, I want to do some research now because I was thinking about it. Mood. While irritability can be present, it's not the defining feature like it is in DMDD. Outburst behavior is often more argumentative and defiant rather than explosive. With DMDD, let's see, severe and recurrent temper outbursts accompanied by persistent irritability or anger, frequent intense temperature changes that are out of proportion to the situation, and a consistently irritable or angry mood. Intense and persistent irritability or anger is a core symptom. Outbursts are severe, disproportionate to the situation, and occur frequently. Mood versus behavior. ODD focuses on okay, I see. ODD focuses on behavior while DMDD focuses on mood. Intensity of outbursts. DMDD involves more severe and frequent outbursts than ODD. Irritability. DMDD. Diagnostic criteria. DMDD has specific timing and frequency requirements. Outbursts must occur multiple times per week for at least a year that are not as stringent for ODD. Okay. Oh, wait, hold on, I found something. I found something. The key differences, temperamental, environmental, okay. Limited parental, okay. Overview of ODD. I don't know what or whatever, I don't know. There are neurobiological markers that are heavily associated with ODD, including lower heart rate. Well, that makes sense that I don't have ODD then because I have a high heart rate. No, lower skin conductance. I don't know what conductance reactivity. I don't know what that is. Reduced. I don't know what that is. Basal cortisol.
So cute, baby. Hi.
You're a good girl.
Wait, Krieg, I'm doing research. I can't do the passing mode, and I can't give you back 100 points. Are you? Is it okay, Krieg, if I just don't do the passing? Because I possibly should have turned that off. I am so sorry, Krieg. I should have turned that off after the fact. God damn it! I feel so dumb now. Hold on. I'll probably do it tomorrow. Krieg, I have a thing for you. If you come in tomorrow, just tell me. Just basically tell me because I can't. Because I'm reading and stuff. Okay, just making sure. I should also turn off the jump scares as well for today. For this, you know, because I'm reading, I don't want to get scared for it, so I'm gonna stop the jump scares for now. There are also significant okay, let me see. Reduced abnormalities in the prefrontal cortex, abnormalities in the amygdala. Yeah, amygdala. Let's see. Let's see, how are diagnosed in clinical settings? I don't know. Okay. Interesting. I already know how they diagnose it, so. So now I have some other questions that do not relate to me. Like, What is OSDD? Other specified dissociative disorders, mental health diagnosis for conditions involving dissociation that don't fully meet the criteria for other specific dissociative disorders like DID or dispersonalization derealization disorder. It's used when a person experiences dissociative symptoms that cause significant distress or impairment, but the symptoms don't fit neatly into other established categories, okay? Let's see, it's used when symptoms of dissociation are present, but the full criteria for, okay. For example, some might have distinct identity states like in DID, but without the complete amnesia between them. Okay. I see. Chronic and recurrent mixed dissociative symptoms, ongoing dissociative experiences that don't fully align with other disorders, identity disturbance due to coercive persuasion, identity changes or confusion resulting from intense manipulation or control. Oh, that's fucked up. Acute dissociative reactions to stressors, brief temporary dissociative episodes triggered by stressful events. Dissociative trance, episodes of trance-like detachment and unresponsiveness that are not culturally accepted. What? Culturally accepted, I don't get that. It's often linked to past trauma. I think I'm learning things, Rax. Because these were questions I had. I don't want... I know what an alter is. I had friends at one point or another that had OSDD. Okay, for pathology. Okay. Let's see, what are the questions? What are the... no. What is... borderline personality disorder? Borderline personality disorder, or BPD, is a mental health condition characterized by instability in mood, self-image, and relationships, along with impulsivity. Okay, so it's not like... Okay, wait. What is... Now I have to look up what is the difference between... and bipolar. Borderline personality disorder and bipolar. Well, both BPD and bipolar disorder involve mood fluctuations. They differ significantly in the nature, duration, and triggers of these mood changes. Bipolar disorder is characterized by distinct episodes of mania or hypomania and depression, with periods of relative stability in between. BPD, on the other hand, involves intense, unstable moods and emotions that are more reactive to external events and interpersonal interactions and can shift rapidly. Okay, I see. I get it now. Okay, so BPD is like bipolar, but 100 times worse or something like that. Duration of mood changes. Mood episodes in bipolar are relatively sustained, meaning they last for a longer period, days to months. Compared to bipolar, BPD is characterized by distinct episodes of mania. On the other hand, it involves intense, unstable moods and emotions that are more reactive. Oh, okay, I see, I get it. Mood fluctuations. BPD involves rapid and intense. Oh, mood swings. Got it. Okay, I see now. Okay, that's how BPD works. Okay, that's good to know. I almost want to know, how does a psychiatrist diagnose bipolar? What? Do what? Hi, Swaggy, how are you today? And now, for two surgeries. How does...
You're a good girl.
How does a root canal work? What's this? Thank you, though. Push the wrong button. Well, that's fair. I'm a good girl one. That's fair. Oh, you meant to do good girl, not do it? Okay. That's funny, though, that you messed that up. Just saying. That's good to hear, Swaggy. It's been a while since I've seen you in my chat. Vice versa, though. Okay, let's see. Would you guys want to watch a video of how root canal works? Okay, because I have to get a root canal at some point. So I was curious how they work, you know? Okay, over here. Oh no, what? Oh, okay, lurk. Okay. That's fair, Swaggy. Root canal, you know what? I'll subscribe just in case I need to. What? I'll also watch that one.
Who's a good puppy?
I'm a good puppy. Specialist.
Nothing looks, feels, or functions like your natural teeth. And with the right care, your smile can last a lifetime.
How does this smile looks like something? Is somebody messed up or something? I don't know. I'm sorry. I'm not gonna
But
make fun of
problems
it.
like decay, disease, or injury can threaten teeth.
Yeah, I have decay on a tooth where they need to do a root canal, and I hadn't. You guys know I had all 4 of my wisdom teeth out. It's healed except for the bone, you know.
And ruin smiles. Thanks to advances in treatment and technology, many teeth can be saved. One way a tooth can be saved is
Alright,
with a
here we go.
procedure called root canal treatment, also known as endodontic treatment. Endodontics is a specialized area of dentistry focused on treating disease.
Trigger warning. For anyone who doesn't want to see tooth surgery or a root canal actually happening. Trigger warning. Lurk now and forever hold your peace. You know.
Or injury to the dental pulp. Endodontists are dental specialists with advanced training in root canal treatment. They are experts in saving your natural teeth using state-of-the-art
Okay.
technologies like microscopes and
Let's see if they actually perform the surgery in this video. Or like show how the surgery works. Okay, here we go.
If the pulp becomes inflamed or infected,
Yeah, I have
your
an
endodontist
infected.
will remove it, relieving
I do have an infection right under it, but
your pain or discomfort. Here's how root canal treatment disease or injury can threaten teeth
What did I
and
just
ruin
do?
smiles. Thanks to advances in treatment and
Come on.
technology, many teeth can be saved. First, your endodontist will numb the tooth so that you won't feel anything during the procedure. A small shield isolates the tooth, keeping it dry and clean.
okay.
An opening is made through the crown of the tooth and into the pulp chamber.
Ow, that looks painful.
Fluid is put in the canals to kill any bacteria and help rinse out debris. Then, the pulp is removed. Using small instruments, the endodontist carefully cleans and shapes the canals. After the space is cleaned and shaped, the endodontist
That looks so painful.
fills and seals the root canals. In most
Oh.
cases, a temporary filling is placed to close the opening until you see your dentist. After your endodontist is finished, you must return to your dentist to have your tooth properly restored with a filling or crown. That protects the tooth and is important to ensure the success of your root canal treatment. A tooth that has had root canal treatment often lasts a lifetime, so you keep smiling with confidence.
Okay. Okay, I see. Let's save this to the Just Chatting Research so I can put it in the description of the video. Okay. Sorry. Oh shit. Okay, trigger warning. Grossness. Grossness of the tooth getting fixed. It's a close-up of the tooth getting fixed. Tooth decay cleaning. Anesthesia. Needles. Let's not worry about that. Okay. Yeah, I won't watch this right now. I'm not gonna watch this right now. If people want to watch it, you can find my video and just click the link. Yeah, I didn't like that either. I am so sorry for showing people that. Yeah, it's disgusting. I'll probably watch it on my own time. But for now, I don't think I should watch it on stream. Okay, anyway. Now to bariatric surgery, which is something I want to get, you know? How does bariatric surgery go? How does bariatric surgery work? That's what I meant to look up. Okay, good. Oh, that's fair. That's fair. Okay, bariatric surgery. I wanted to know, but like, bariatric surgery, also known as weight loss surgery, works by either restricting the amount of food the stomach can hold, reducing nutrient absorption, or both. These procedures alter the digestive system, leading to weight loss and improvements in obesity-related health conditions. Interesting. Let's see, what's this? Okay, I found a hopefully good source for people that want to learn more about it. Gastric sleeve, gastric banding. Which one is more effective than the other, if I remember correctly? A portion of the stomach is removed, creating a smaller sleeve-shaped stomach. This limits the amount of food that can be eaten and reduces the projection of the hunger hormone. A band is placed around the upper part of the stomach, creating a smaller pouch. Okay. This is gonna be a dark question. How often do Okay, the mortality rate for bariatric surgery is generally very low, with rates typically below 0.5% for established treatment centers. While some studies report higher rates, these often include longer-term follow-up and can be affected by patient characteristics and the specific surgical procedure. Short-term mortality is 0.13%. Long-term mortality is factors like age, sex, and pre-existing health conditions. 6%. Okay. That 1-year case fatality rate with approximately 1% and nearly 6% at 5 years. However, another study found that long-term mortality rates of bariatric surgery patients were significantly lower than those of the general population. Okay. Okay. Does trypophobia cause disgust more often than fear? Trypophobia is more strongly associated with disgust than with fear. Okay. So both emotions can be involved. While individuals with trypophobia may experience a sense of fear, the dominant and more frequently reported reaction is disgust when confronted with clustered holds or similar patterns, according to research. Okay. I just wanted to know that because I wasn't sure. That's interesting, though. Okay. What is trypophobia? Trypophobia is the fear or aversion, so disgust in a way, to the appearance of clusters of small holes or bumps. It's not officially recognized as a mental disorder, but some people experience significant distress and functional impairment due to it. Okay. Symptoms: feelings of disgust, anxiety, panic, or even physical sensations like skin crawling, sweating, or nausea when confronted with these images. While the exact cause is unknown, some theories suggest it could be linked to an evolutionary aversion to patterns associated with dangerous animals or skin conditions. Interesting. That's interesting. I'm not gonna link anything to that. You can just look up what is trypophobia, and the AI overview has like an overview of what it is. And then the dictionary says extreme or irrational aversion to or fear of clusters of small holes or bumps. Yeah. Yeah, usually I almost brought up a picture of a trypophobia image, but I know that would fuck people up. Okay. So I know some people here aren't ABDL, you know. So we're gonna go on to those questions. ABDL or adult baby diaper lover is a paraphilia, not something bad, just an outside the ordinary love or like, you know. Characterized by desire to regress to a younger age, often involving the wearing of diapers, or a fetishistic attraction to diapers and the associated behaviors. Not all the time, this is wrong. It's a broad term encompassing both sexual and non-sexual aspects. Okay, now it redeemed itself. Including age play and diaper fetishism. Age play I don't believe in, and diaper fetishism, okay, whatever. Regression, this aspect, adult baby AB. This aspect involves a desire to experience a childlike state, often involving activities associated with infancy or early childhood, such as wearing diapers, using baby bottles or pacifiers, or being treated like a baby. Non-sexual. It's non-sexual, mind you, adult baby. While ABDL can be sexually motivated, the adult baby, its literally in quotes aspect, can also involve a non-sexual desire for comfort, security, or a sense of innocence. I used to be a mix of AB and DL. I like AB more. Fetishism. The DL part is the fetish part most times. This refers to a sexual attraction to diapers. The attraction can stem from the tactile experience of wearing a diaper, the visual of someone in a diaper, or the associated behaviors. Multisensory. The experience of wearing or seeing someone in a diaper can be a highly multisensory one involving touch, the feel, sight, the visual, and the sound, the crinkling of the material. ABDL is often considered a part of a spectrum of behaviors collectively known as paraphilic infantilism. This term encompasses various paraphilias involving infantilism, including diaper fetishism, while some individuals within the ABDL community engage in these behaviors primarily for sexual gratification. Others may focus on the emotional or psychological aspects of regression. See what I mean? Usually in the skin? What? Oh yeah, okay, sorry, I forgot about that. Let's see. There's a Wikipedia page, but I don't know if that would be a good one. I'm not looking at WikiHow, no. Can't make me. Okay, let's see if I can find something on here. Form of age play. Okay, yeah. I wouldn't say age play that involves role-playing a regression to an infant-like state. But it can be where people are like pretending to be babies but do it sexually, which is the gross part about things. Depending on the context and desires of the people involved, paraphilic infantilism may be expressed as a non-sexual fetish, kink, or simply as a comforting platonic activity. People who practice adult baby play are often colloquially referred to by themselves and others as adult babies or ABs. Behaviors vary, but may include things such as wearing childish clothes, wearing and using diapers, cuddling with stuffed animals, drinking from a bottle, or sucking on a pacifier. And when done with others, engaging in gentle, nostalgic, and nurturing experiences. Oh, hi T. I've just been researching stuff or whatever, and I'm trying to teach people what ABDL actually is. Because some people are like so disgusted in it, and it's like they only see the sexual aspect of it. There isn't just, you know, yeah, it's part of BDSM, but there are times where it's not sexual, like when you're in little space. This cross-dressing furry fandom versus Oh, here we go. Versus pedophilia. Paraphilic infant is not to be confused or conflated with pedophilia, as adult babies, adults who engage in paraphilic infantilism, or ABDL, you know, are only may be participating in sexual roleplay either by themselves or with consenting adult partners. Adult again. People with this fetish are not as a rule attracted to children and do not seek them as sexual partners. And paraphilic infantilism is not related to pedophilia right there, or any form of child sexual abuse. People don't get that. Sexologist Gloria Brame states that infantilists who recognize and accept their sexuality and its possible roots in infantile trauma tend to be acutely protective of real children. Boom. Exactly, T. Exactly. Oh, what's that? Ooh, I'll have to read that too. Ooh, I didn't know you had that. I was looking at the fucking, whatchamacallit? The wiki, which I don't know how, like... I found another one, but I won't read that, it's too short. Okay, I'll have to link that one too. That is a site by Big Right? Ooh, nice. Why would someone want to wear diapers or be a baby? ABDLs might have infantilism, a diaper fetish, or some other condition. Alternatively, they might simply have learned to enjoy diapers as a kink or might enjoy age play. What are infantilism? Is other than a potential risk of diaper... Sorry, I had to read that. I couldn't not laugh. These desires aren't directly harmful. Still, indirect risks, concerns, and misunderstanding might need to be addressed. Okay. I'll have to read more about this. This is a nice site. Thank you, T, for letting me know. That's okay, I understand that. Oh, I'm sorry, Paul. Get hugs. Okay. Criminologist or criminologist or whatever. Stephen and... Wait, I wasn't there yet. Okay. Stephen and Ronald Holmes believe that while there's no simple origins, no simple answer to the origins of infantilism, the practices may involve an element of stress reduction similar to that of... I don't like that term. Cross-dressing. These criminologists state that the paraphilia is not inherently a crime in and of itself and differ from child sex abuse. That's fair, T. How old... Actually, nope. Don't tell me. Don't tell me in chat how old you are. Because I thought you were, like, early to mid-20s, but I think you're in your, like, early 30s, right, T? I could be wrong. I don't know. Your voice is very young-sounding, you know? Ha! Sorry. I don't mean to laugh because I am ABDL, so I think I have... the right to laugh. It's okay, I'm 41. You're 41? No fucking way. T, you're 41? You sound so much younger. Now I want to see your face, but I know you probably don't... There's no fucking way. T, if you want to send me a picture of your face, I can tell you when to delete it. If you don't want me to, like, keep it or anything. But my Discord DMs are open, but you don't have to, of course. I'm just curious if you look young as you sound. The organization Diaper Pail Friends was established in San Francisco, growing to approximately 3,000 members in 1995 through magazine articles, books, talk shows, and the internet. The organization was studied in 1995 by a group of sexologists, though the results were not published. In 2001, the New York organization Still in Diapers was founded for diaper fetishists. In 2008, the Diaper Pail Friends had expanded to a national organization and claimed a membership of 15,000. Nice! Let's see. In 2016, that's fair, Rex. This is where I laughed because I wasn't expecting this. In 2016, Tykables opened the first dedicated paraphilic infantilism physical retail store in Mount Prospect, Illinois, with controversy from the local community. Fuck 'em. The store owner believes that it helps to break the stigma, but that's fair. Surgical terminology and definitions. Okay. That's pretty neat. Okay, let's see. Did I have any other questions that weren't just answered? Okay, I know why some people age regress. What is age regression in adults? Age regression in adults refers to the experience of temporarily reverting to behaviors, thoughts, or feelings associated with an earlier stage of development, often as a coping mechanism for stress or trauma. Okay. It's not a physical change in age, but rather a psychological and emotional state where an individual may exhibit childlike behaviors or thought patterns. Not a physical change, coping mechanism, temporary or long-term. Regression can be a brief response to a specific situation or a longer-term pattern of behavior. Okay. Okay, thank you for the picture. You didn't have to, but thank you. You really need to keep up your mutton chops, but you look good. If you were fully shaved, you definitely look like a child. I'll tell you that much. You don't look like how you sound, though. That's the weird part. You don't look how you sound. But that's probably just the facial hair, you know? But I won't be like, shave them off. Yes, that is true. Clean shaving does take off about 20 years. That's fair. I kind of mentally shaved you just to see what you look like. It was like, yeah, you know. Coming into the fetal position, okay. Okay. This is interesting. Okay, I have few links that I just found that I'll link in the description of the VOD. Oh, T, are you going to stream today? Ren would kill you for that? Oh my god. That's funny, T. That would be hilarious. Just like, will you only shave like the center or whatever and that's it? Just to keep the mutton chops or whatever? Because that would be funny. Ooh, I'd like to see you eventually braid them together. That'd be interesting. Also, T, are you streaming today at some point? Let me, 2 hours and 33 minutes? Holy shit. Understanding age regression. Yeah, I got that. Actually, nobody asked. But I went to an ABDL event. My first ABDL event I went to. Somebody talked to me. One person talked to me, and I became friends with them. They regressed me in a way, you know? They say that my little age is about 2 to 4. Because I can still technically talk, I just like instead of L's and R's or whatever, is like W's instead, you know? What do you mean? Oh, yes, I plan to stream a few times today. I don't know when I will stream the first part, and tonight will be drink stream. Nice. But apparently that's what they said. I thought it was like 3 to 4 or something like that, but I was wrong. Yeah, I just need to figure out what I'm streaming for the... Ah, I see. Let's see, as a symptom... Oh, more likely could be a symptom of one of these conditions. BPD, dementia, major depressive disorder, post-traumatic stress disorder, schizoaffective disorder, dissociative identity disorder, or schizophrenia. Trauma recovery and trauma. It says trauma. Recreational age regression. Is age regression safe? There's no inherent risk. You practice it as a form of self-help or relaxation. You may want to make sure you're in a safe place and around people who understand this technique. If, however, you find yourself reverting to a younger age without your control, you should seek help from a mental health professional. You may be showing symptoms of an underlying issue that needs to be... Oh, okay. The takeaway: age regression occurs when you mentally retreat to... Okay, I see. Let's see, age regression in adults and what happens. No, this one I don't like. I don't like this one. This one's kind of stupid. Okay. Baby dog, inability to self-soothe, whining, becoming mute. Using a doll stuffed animal for comfort, rocking, like that. Okay, pacing, physical aggression, temper tantrums, inability to perform basic routine tasks, eating, toileting, and grooming, pretending not to understand. I don't know how much I trust this one. Okay, no, it goes a lot further into detail. Okay. I see. Ah, I see. Does anyone else have any questions that I should look up and we can learn about together? Because I think I ran out of questions that I had. Hold on, let me just do something real quick. Okay, there we go. I was gonna finish. I have no questions. Everything I had questions for about. That's good to hear, Rex. I was gonna end stream now because I don't know what else to do at the moment. I could do Super Meat Boy, but I could, but I have to. Also, it's been 2 hours and 39 minutes. That's usually how long I've been streaming lately. Okay. I'm trying to think what I could do right now while I wait for T to go live. Because I'd love you read you out, T, if you go live soon. Let's watch another video. Let's react to this video. That's a joke that I made, by the way.
On what you got wrong and why. Find the link to the autism set below. With restrictive, repetitive behaviors and interaction and communication difficulties, with restrictive, repetitive behaviors and interests. As the name suggests, a spectrum of different presentations is possible, ranging from severe disability all the way to cognitive strengths. This
Wait, what? What does it mean, severe I get it.
important because historically, the term Asperger's syndrome was used to describe those with higher functioning or higher IQ, but is now considered part of ASD, as are other neurodevelopmental conditions like childhood disintegrative disorder. And it's worth noting, ASD is now becoming increasingly seen as an example of neurological and cognitive variation between people. As we mentioned, the clinical presentation can vary greatly, but the two core domains affected are social communication and interaction, and repetitive, restricted, or stereotyped behaviors, interests, or activities. In children, the manifestations depend on the age as well as the domain involved, with over 80% of...
I think we already learned this in another video, but if I'll still most likely... Why is this a thing? Spreading autism in adults, common sense, and traits. I don't want people to know that I'm autistic. I don't want people to be like, are you autistic? Just randomly,
Hang on a second. I think that's an autistic person. Alrighty then, these...
Yeah, I'm not watching this. I'm not watching that. Actually, T, would you be okay if I didn't raid you today? Because, actually, no, they're just ending, I think. I had somebody... Oh, no, they're ending. Never mind. I don't know what to watch. Or react to, at least. Nine weird autistic traits? What? What? Some of these are fucking stupid. Why are some of these like a thing? Oh, sorry. The Angela, no. What's the number is ADHD 5 key differences explained. Oh. Ooh. I might be able to.
Is it autism? Or is it...
Let's see how they can tell the difference.
ADHD. It's easy to get these two confused. Today, we're breaking down 5 key differences between ASD and ADHD, because although these two might sound similar, they're definitely not the same. A lot of autistic folks also have ADHD, but that's a different video that I'll link below. You should watch that one next. But for now, let's talk about the real differences, starting with number 1, processing time. Thinking slow versus fast. If you're autistic, you'll often need time to process things.
Yeah, okay.
Someone says something, and your brain takes a minute to think about it, or 5, or a year. It's like your thoughts are on delay. Sometimes, by the time you're ready to respond, the conversation has probably moved on, and you're left scrambling to catch up, or just off in your own conversation about that thing 3 topics ago that you wanted to say something about. I don't even know what people are talking about half the time. I don't even know what I'm talking about half the time. With ADHD, thoughts are coming at you fast. Your brain is firing off ideas quicker than you can keep up.
Hold on, I need to pause this because I don't want to like make it seem like I'm not like doing certain things. I'm just looking for somebody to read that I would like to watch or something. See, how long have you been live? Oh, you haven't been live long. Okay, that's good. I'm trying to find somebody that I want to read out to. I have somebody possibly. Actually, you know what? I have a new one that I have an idea for.
And you might interrupt to blurt things out just to get them out before they're gone. But your brain doesn't stop with one thought.
Okay. So if people want to watch that, it'll be linked down in the description of the VOD. I have somebody I want to raid out to. I think that I can. Yeah, I can. Okay, so if everybody can join me for raid, that would be great. If you can't, however, that's okay too. Raid 1 if you're a follower, or raid 2 if you're a subscriber. Copy either of those messages and paste them into the chat of who you raid out to. /raid. Let's hope I can. Okay, we're gonna raid out to Torn Roth, who right now is playing Final Fantasy Mystic Quest. So if everybody can join me for a raid, that would be great. If you can't, however, that's okay too. I hope you all enjoyed the stream. I hope to see you all next time, and I hope